Have you ever noticed some difficulties within your child or someone that you love? Something along the lines of difficulties with social struggles, sensory sensitivities, or repetitive behaviors, but you're unsure of what to do next? Getting the right diagnosis can be life-changing, and getting checked out by a professional can really be a great support. Hey everyone, my name is Dr. Dona, CEO and founder of Dona Wellness Clinic, along with a psychiatrist who is passionate about all things mental health and wellness. And thank you for coming to my channel today. So today we're going to chat about autism testing, like what actually really happens during those assessments, what the heck an ADOS test is, and how to figure out if you or someone you care about might benefit from getting evaluated. I know that this stuff can be overwhelming, so I'm just going to break it down in as plain English as possible. So feel free to sit back, grab a coffee or a juice pack, and let's get into it. What I'm covering today: signs that make you go, could this be autism? The test professionals actually use without all the medical jargon, and how to know when it's actually time to book that appointment. And I promise to try to keep this as real as possible. No sugarcoating and no scary medical talk. If you want more information about autism specifically, please see my additional videos. So let's talk about signs of autism. So autism is this huge spectrum, right? That's why it can be so confusing. I've literally seen hundreds of autistic people in my practice, and honestly, no two are exactly alike. So with the little ones, what might actually catch your attention for you to consider autism? Maybe your 2-year-old isn't really talking yet when the other kids at daycare are chatting up a storm. Or maybe they have had some words, but then kind of stopped using them. That's something to pay attention to. You might notice that they don't really look at you when you're talking to them. And you could be saying their name over and over, and they're just kind of in their own world. Then there's the repetitive stuff, like flapping their hands when they're excited, or spending forever spinning the wheels of toy cars instead of actually playing with them. Or maybe they line up all of their toys in perfect rows and get super upset if you mess up the order. A big one is that they might seem way more interested in objects than in people, like the other kids at the playground might as well not exist. And sensory stuff is huge. Maybe they absolutely lose it when they can hear the vacuum cleaner, or they only like to eat like 3 different types of food because everything else feels wrong or gross in their mouth. And for older kids, school-age kids, things start showing up differently, especially once they're in school around lots of other kids. You might notice your child just doesn't get the social stuff that seems to come naturally to others. They take things super literally, like if someone says it's raining cats and dogs, they might actually look outside for falling animals. They also might have these really intense interests, like knowing absolutely everything about dinosaurs or trains or whatever, to the point that that's all they want to talk about, and might redirect people to talk about that conversation topic again. School can be tough because it's sensory overload, right? Bright fluorescent lights, loud cafeteria, kids screaming. For a kid with sensory sensitivities, that's like torture. And making friends, that can be really hard. They might want friends, but might just struggle with the back and forth of conversations or understanding all of those unwritten social rules. Now for adults, this is actually something I'm seeing more and more in my practice. Lots of people make it all the way to adulthood without actually realizing that they're autistic. A lot of adults have gotten really good at what we call masking, basically putting on this neurotypical mask in public. They've studied how others act and can copy it pretty well, but man, it's exhausting for them. Like they might seem totally fine at work, but then completely crash when they get home because it took away all of their energy. Relationships can be tricky too. Dating, keeping friendships, all the subtle communication that happens between people can feel like trying to understand a foreign language without any actual translation or understanding. And then there's the organizational stuff. Maybe they're brilliant at their specialized job, but their apartment is a disaster because executive functioning, stuff like cleaning and organizing, just doesn't compute. So look, if any of this is ringing any bells for you, either for yourself or someone you care about, it might be worth looking into an evaluation. And that's what we're going to talk about next. So let's actually talk about what happens during autism testing. I'm going to cover all of the tests that you might run into, even ones you've probably never even heard of. It's going to seem like alphabet soup, but I'll make it make sense, I promise. So, screening tools. These are the first pass, and they aren't diagnostic. They are just the first pass to see if more testing could make sense. For the little ones, the MChat is super common for toddlers between the ages of 16 and 30 months. MCHAT stands for Modified Checklist for Autism in Toddlers. It's basically 20 yes or no questionnaires for parents, like does your child point at things or does your child respond when you call their name? There's also the ASQ, Ages and Stages questionnaire. This isn't autism specific, but looks at general development across different areas. There's even a social emotional version called the ASQ SE that digs deeper into those areas. Pediatricians love this one for regular checkups. Another one is the PDDST2, Pervasive Developmental Disorder Screening Test. Yeah, I know that's a mouthful. It's used in pediatric offices as another early screening tool. For the older kids ages 4 and up, there's the SCQ, Social Communication Questionnaire. It's 40 questions based on more in-depth ADIR that I'll talk about in a minute. All these screening tools take about 10 to 15 minutes to fill out. If they flag potential autism concerns, that's when we moved into more diagnostic testing. So, the big diagnostic tests. For the more comprehensive testing, these are the tests that actually lead to a diagnosis. For parent and caregiver interviews, there's the ADI-R, the Autism Diagnostic Interview Revised, and this is a super detailed, structured interview with parents or caregivers. It takes a good 1 to 2 hours and covers language development, social interactions, and repetitive behaviors. It's incredibly thorough. There's also the DIGAS, the Developmental, Dimensional, and Diagnostic Interview for Autism, for ASD, or Autism. It's another structured interview that focuses on autistic traits across different developmental areas. Some clinicians prefer this one, especially for more complex cases. Then there are the direct observation tests. The ADOS-2 is the gold standard that most people have heard of. ADOS stands for Autism Diagnostic Observation Schedule. It has 5 different modules based on age and language ability. For little kids, it can look like playtime. The specialist brings out toys and games and watches how the child interacts. For older kids and adults, it's more conversation-based. The specialist might ask you to tell a story or describe your friends. Big news for those in Florida if you're looking for ADOS testing specifically, we are able to offer it in our clinic virtually or in person, so don't hesitate to reach out if you wanted to get tested using ADOS or want more information on getting ADOS testing done. Then there's also the CARS-2, the Childhood Autism Rating Scale. This is where the clinician observes and scores a child across 15 different behavioral categories. It's been around forever, and it's especially good at showing the severity of autism symptoms. Then there's the GARS-3, the Gilliam Autism Rating Scale. It's similar, but uses both direct observation and parent input for ages 3 to 22. And for the really little ones, there's the STAT, the screening tool for autism in toddlers and young children. The specialist will actually play with your child in specific ways to see how they communicate, imitate actions, and play. It's pretty fascinating to watch. The thing with the direct observational testing is that while it might just seem like play or talking, the observer is actually watching and observing everything that you're saying and doing and scoring it to be able to come up with a comprehensive diagnosis for autism. In addition, there's cognitive and developmental testing. Most good evaluations don't just stop at autism-specific tests. They usually include testing of other skills too. And IQ testing is super common, not because intelligence is related to autism, because it's definitely not, but because understanding cognitive strengths and challenges is helpful. They might use the WISC for older kids or the Stanford Binet. There's also the Vineland 3, the Vineland Adaptive Behavioral Skills. It measures daily living skills, socialization, and communication abilities. Basically, how well someone can function in everyday life. This helps create a fuller picture beyond just the autism symptoms. Now, there's no blood test or brain scan that can actually diagnose autism, but sometimes doctors might recommend medical testing to rule out other conditions to check for genetic factors. Genetic testing like chromosomal microarray or whole exome sequencing looks for genetic changes that might be associated with autism. There's also specific testing for Fragile X syndrome, which can present with autism-like features. Some kids might get an EEG to check for seizure activity, which is more common in autistic people, or even an MRI to look at the brain structure. Some specialists might also recommend metabolic and mitochondrial testing to rule out certain disorders that can mimic autism symptoms. Just know that these medical tests are usually only done if there are specific concerns beyond the core autistic symptoms, like seizures, regression in skills, or unusual physical features. For kids who have challenging behaviors, there's often something called FBA, Functional behavioral assessment. This isn't autism specific, but it's super helpful. It basically looks at why certain behaviors are happening and what purpose they serve. Like, is your kid having meltdowns because they're overwhelmed by noise, because they can't communicate what they want? Understanding the function helps create better support strategies. There's also the SRS-2, Social Responsiveness Scale. It specifically measures social impairments related to autism. And for sensory issues, which are huge for many autistic people, there are specific assessments like the Sensory Profile or Sensory Processing Measure, SPM. These help identify if someone is over or under responsive to things like touch, sound, movement, or visual input. Most comprehensive evaluations also include assessments of speech and language. For little kids, they might use the PLS-5 Preschool Language Scale, which looks at both understanding and using language. And for older kids, there's the CELF-5 Clinical Evaluation of Language Fundamentals. This digs deeper into language skills like following directions, understand grammar, and social communication. And finally, occupational therapy evaluations look at fine motor skills like writing or buttoning up clothes, sensory integration, and daily living. I know that's a ton of information, but I wanted to give you the full picture of what might happen during an evaluation. Most people won't need every single one of these tests. The assessment gets tailored to each individual's specific profile and concerns. So when should you actually go and get evaluated? My honest answer is, if you're watching this video or wondering about it enough, it might be worth looking into. For toddlers and preschoolers, don't do the whole wait and see thing if your gut is telling you that something is up. Research is super clear that earlier intervention makes a massive difference. Some clear signs it's time to check out are if your 18-month-old isn't pointing at things or using gestures like waving. Your 2-year-old just isn't using words meaningfully. Or your child was developing typically before and then actually lost skills that they had. And look, I know that taking that step can be scary. Nobody wants to think something might be different with their kid, but here's the thing, getting a diagnosis, even if there is one to get, opens the door to services and support that can really help. And I've seen this over time and time again with patients that I've seen within my clinic that were hesitant to get evaluated, get actually diagnosed, and be able to properly get that support and help. For older kids, school often brings issues to light. Maybe your kid is brilliant academically, but keeps getting in trouble for social stuff. Or maybe they're having meltdowns every day after school because they're completely overwhelmed. Or honestly, sometimes it's just that you notice that your child seems to experience the world differently than their peers and you want to understand why. If teachers are reaching out with concerns, take that seriously. They see your kid in comparison to other kids of the same age, so they often notice patterns that you might not. Now, for the grown-ups watching this video, maybe you've spent your whole life feeling like you're from another planet, like everyone else got some secret rule book to life and that you missed out on. Or maybe you've been diagnosed with anxiety or depression, but treatments haven't quite worked because they might not be addressing the underlying neurology. Or maybe you have a child who was diagnosed, and as you learned about autism, you started recognizing some of these symptoms or patterns within yourself in the description. There's no wrong time to get evaluated. Even if you've made it into adulthood without a diagnosis, understanding how your brain works can be incredibly liberating. I've had patients oftentimes say when they got diagnosed, things like, okay, wow, this is such a relief and that my life makes sense, or how I've navigated the world just kind of makes sense now and it doesn't make me feel so alone, which is, yeah, life-changing. And just so you know, adult diagnoses can be trickier. Not all providers are experienced with how autism presents in adults, especially those who've spent decades masking. So look for someone who specifically mentions adult autism assessment in their practice, like myself or at Dona Wellness Clinic. So who actually does these evaluations? So it can vary. For younger kids, there can be developmental pediatricians like my husband, Dr. Scott Dona, or child psychologists or neuropsychologists, some psychiatrists like myself, or sometimes a team approach with speech therapists or occupational therapists too. When you're looking for someone, ask specifically about their experience with autism assessment, and don't be afraid to ask what tests they use. If they don't mention the ADOS or similar standardized assessments, that might be a red flag. And getting on wait lists can be frustrating. Some places have months-long wait lists. If that's the case where you live, get on multiple lists, and in the meantime, look into support groups online. There are amazing communities out there of autistic people and parents who can offer guidance while you wait for the next official assessment. And I've noticed that this was something happening within my own clinic, which is why at Dona Wellness Clinic, we are now going to be able to start offering ADOS testing, and there is no wait. You can get in as soon as a week from now. So what's next? Let's say your loved one does get diagnosed with autism. What should you do? For kids, it might mean early intervention services, school accommodations, speech or occupational therapy, and social skills support. For adults, it might look more like workplace accommodations, finding community with other autistic adults, learning about sensory needs, and self-advocacy, and sometimes therapy focused on autism-related challenges. But honestly, one of the biggest benefits I see is just the relief of understanding. Having a framework to make sense of your experiences or your child's experiences can be incredibly powerful. And remember, a diagnosis doesn't change who you or a loved one is. It just gives you the language and context for strengths and challenges that were always there. All right, so that's the rundown on autism testing. I know I covered a lot, but hopefully it all makes a little bit more sense now. The main takeaways are that autism looks different in everyone. Testing involves observing behaviors and development, and if you're wondering if you or your loved one might be autistic, it might be worth looking into. And listen, whether you're on this journey, just starting to wonder, waiting for an assessment, or recently diagnosed, know that you're not alone. There are huge communities out there of autistic people and families who get it. So thank you for watching this video, and if you found it helpful, hit that like button and subscribe for more mental health content where I try to keep it as real as possible. Drop your questions below and I'll try to respond as fast as I can. And also, if you're interested in other videos on mental health or wellness, please let me know and I'd love to try to help and do more content. Take care of yourself and I'll see you in the next video. Take care.